Am I to understand, therefore, Professor Raghavan, from what you said, that let's say the Oxford vaccine, which is likely to try and get emergency approvals in the UK in the next fortnight, gets it, it will automatically get it from an Indian regulator as well at the same time. So by the end of the month, the Oxford vaccine could well be available for emergency use. Is that what is being suggested?
What our regulator does is they examine global studies and the results from our bridging studies and look for safety, immunogenicity and efficacy. And they will look at all three together and ask whether emergency use authorization can be given. What emergency use authorization means is, as the results of phase 3 trials which show the efficacy as well as the previous trials which show safety and immunogenicity come in, and even as more results from the phase 3 are coming, use can be authorized. So I think we can expect a result soon. It may or may not be simultaneous, but it will be very close to what authorization this vaccine receives elsewhere.
And am I correct, Professor, in saying that the Prime Minister seemed to suggest, as has been expected, that health workers will get the first dose of vaccines, that the first phase will be focusing on health workers primarily?
Yeah, so, the WHO has said in its prioritization that frontline workers and health and social care settings, people over the age of 65 and people under 65 with comorbidities will get priority. What the NEGVAC, the committee headed by Dr. Vinod Paul of Niti Aayog and Mr. Rajesh Bhushan, the health secretary, examined what our situation is. And of course, as we know, that the priorities are to protect the health and pandemic response system and reduce deaths due to COVID-19. Most of our deaths are with people over 50 years of age who have comorbidities also. Therefore, our priorities are healthcare workers who number about 1 crore, then frontline workers about 2 crores, and a priority group 1, which is 26 crores, which is people above the age of 50 years with comorbidities, that is people above 65 in general and people above 50 with comorbidities. That's 26 crores.
One of the concerns has been pricing. Before the Bihar elections, politicians announced that, particularly from the ruling party, the government ministers, that people will get free vaccines. Apparently, at today's all-party meeting, when the question of pricing came, the Prime Minister seemed to suggest this hasn't been decided yet. What are we to understand? Will we be giving the vaccines free, or will there be a price tag attached to it?
The purpose of a vaccination program is simple. It has to reach the right number of people, the maximum number of people, so that the vaccination is effective, both in protecting you and those around you and the community in general. Therefore, pricing has to be calibrated so that those who can afford might need to pay, but those who need and may not afford will have vaccines provided for. So this will be done in a way, as the Prime Minister said, in discussion with various stakeholders and including the state government.
No, but that still leaves open the question that you could have differential pricing systems in different states. Is that what we are saying? And different vaccines will be priced differently. The Bharat Biotech could be priced differently to an Oxford AstraZeneca, that there won't be free vaccines available to all. Am I correct?
The question of free is related to who buys it. Let me give you the example of the Rotavac vaccine, which was made by a company in collaboration with the government of India, coincidentally Bharat Biotech. The agreement was it will be sold in India for $1 a shot, but it will be sold to the immunization program. That is, the government buys it, and the government distributes it in the universal immunization program free. So the cost is brought down to what the government pays the company, and the government has different mechanisms. It will ask some people to pay, and other people it will give it free, and those are the kinds of discussions. So you can be assured that the vaccine will reach all those it needs to reach at a cost which will range from nothing to something very modest.
One final question, Professor, that when do you expect the Aam Aadmi to start getting vaccinated? We're talking, I'm not saying health workers are not Aam Aadmi, but the focus, as you said, is on health workers, presumably then high-risk groups, and then presumably we'll try and make it as universal as possible. So when do you expect, are you looking at, is it a stage-by-stage process? When do we reach that stage where it is universally available? Or am I jumping the gun?
No, you're not jumping the gun, but we should be a little relaxed about this. There are three phases of vaccine supply. The first is there will be very limited doses available because of the manufacturing requirements.
Right.
Then there will be, little later, large numbers of doses available, and your question will be moot. And even later, there will be a continued vaccination program where everyone will be calm and people will get vaccinated as needed. Right now, we are in a phase just before the limited doses are available, and everyone's asking, when will I get it? How many people will get it? That's why there is a prioritization. The frontline workers, the healthcare workers are indeed a priority. But of course, the elderly, people above 65, people with comorbidities are very important. So it's not that it goes in an ordered manner. Right. It goes in these three categories in a manner where, given the number of doses available, we try to get the maximum reach.
Professor Raghavan, we'll keep coming back to you in the weeks and months ahead because this is going to be a dominant discussion, I'm sure. This is the big challenge before any government, not just ours, but across the world, to ensure distribution, equitable distribution above all else. Thank you so much, though, for joining us and giving us a sense of what lies ahead. Thank you. Professor Raghavan, the Prime Minister's principal scientific advisor on a day when there was some hope that the vaccine could be available in India for emergency use by the end of this month.